Hi everyone. These are the last two videos in this module. These are both about crisis intervention. I split them up. One's going to be about documenting your crisis intervention, and the other one will be about what crisis intervention is. Crisis intervention is typically orchestrated, or you'll know what to do from your behavior intervention plan. Typically, that's placed at the bottom of the FBA or at the end. It could be a separate document, but it's essentially if they engage in their worst problem behaviors, what should you do in those cases when they may be unsafe or others may be unsafe because of it. We're going to talk about what constitutes a behavioral crisis. It is when individuals escalate so much that they're going to threaten their self or others. We're going to learn about Proact and CPI. I just put those in because they're the most commonly used. There are others out there, and they're all pretty similar and good to do. You will do one of these. Exploring non-physical strategies and the last resort physical skills, and I'll explain what those are. We'll identify technicians' responsibilities before, during, or after the crisis, so all the things you have to do. In our next video, we'll talk about accurately documenting the crisis event, which is really, really important. I want to talk about Proact and CPI really quick. These are behavioral crisis trainings. You will need to do one of these or an alternative. Most companies, most funding sources require it of their techs, their BCBAs, supervisors, anyone working within this field. You may have already done that, which is great, or it may be coming up. Be sure to ask about it if it's not communicated to you when you get a position. It's really good information. The first part is always about de-escalation, and that should be familiar to you because a lot of what I've talked about in this course is the same things you would use for those de-escalation techniques. And then the second half of these trainings are about restraint. So it's how to safely restrain an individual who's in crisis in a really safe manner that will make sure that you don't get hurt and they don't get hurt. This is super important because there's been situations where someone didn't have the training or didn't utilize what they were taught and people have been hurt. The last thing we want is to hurt our learners or get hurt ourselves. So it's very important that when you do this training that you pay attention, you try to get the most out of it. And if you're not comfortable afterwards, you ask for more training or more help. What is a behavioral crisis? So it's when a person's behavior is going to escalate to a point that poses a threat to themselves or others. And examples of behavioral crisis is self-injury, aggression, property destruction, and elopement. So property destruction has to be at a level where they may harm themselves or others. Self-injury and aggression at a point where they're going to harm themselves or others is always a behavioral crisis. Elopement sometimes, not always. Elopement depends on where they're going, because if they're going to run to a place where they would be unsafe, then it is, of course, a behavioral crisis. But if they're not running to a place where they're unsafe, then it wouldn't be considered a behavioral crisis. Like I've had students who run straight out to the football field and sit down, and there's no cars, nothing's around. That would not be a behavioral crisis. We can kind of address that similar to we would other behaviors. And you would always follow them to make sure, but depending on where they go, it may be better not to engage in behavioral reduction or restraints because they're safe. They're just really needing a break. Same with I've had kids run to the playground. A playground on a school is probably a fairly safe place to be. If they're running to a busy street, that is a behavioral crisis because there's a much higher percentage that they could be harmed in that case. Common triggers, and these are a lot of the things that we've already talked about, but like denial to preferred items, transition demand, sudden change in routine, sensory overload. It's going to be those four functions in some way. and them not getting what they need, one of their functions. You want to know what the triggers are because it helps you prepare and de-escalate before it happens. For any of the problem behaviors, you should know the triggers, not only the antecedents and the consequences. You'll know the function as well as the antecedents. And occasionally they have something that we call precursor behaviors. So if someone's going to be extremely aggressive, there's typically some smaller behaviors that occur prior to the aggressive behavior, like a buildup almost. You should know those as well. All of that would be in your FBAs if they're done correctly. They should be transferred into the behavior crisis plan or the behavior intervention plan as well. Proactive and reactive strategies. Proactive strategies are all the things that we might use to de-escalate someone and the things that we do just generally to help people engage in positive behavior. So it's visual schedules, choice making, reinforcement system. You can add in things that you may not give pretty regularly, but when we're getting into crisis, we might want to deliver, like an iPad, time in the sensory room, all those things that might be huge rewards for the person. But if you think they're going to crisis, you do whatever you can to get them out of crisis. The idea is they engage in their precursor behaviors, which lead to really bad aggression. And so you see this and you're like, oh my gosh, they're going to get super aggressive right now. What can I do? Here's your iPad, or let's go to the sensory room. And it calms them down. There's this idea that now you're reinforcing those bad behaviors because you gave them something very rewarding. If it is crisis, that's okay. What needs to happen or going to crisis, that's okay. What needs to happen is you need to go back to the drawing board with your supervisor, explain what happens, and we have to create different plans so that we can address all that in an antecedent differential reinforcement way. So it's okay to avoid a crisis with heavy rewards. It's not okay to continually do that over time, and then that's your new behavior chain. And then we're always going to have aggressive behavior. So you got to keep that in mind and work with your supervisors. Reactive strategies are when the crisis is starting or you're in the middle of the crisis. So it's redirecting, prompting, crisis intervention plans. Restraints would be part of that crisis intervention plan. Proactive strategies help prevent behavioral crisis by addressing triggers and setting up the learner for success. And the benefits of proactive strategies are increased predictability, reduced anxiety, more positive interactions, fewer crisis events. Okay, so our introduction. Okay, so Proact. So Proact and CPI are programs, typically 3 days of training or something similar. Proact, or professional assault crisis training, is a philosophy-based approach to crisis intervention that prioritizes dignity, safety, and the use of non-physical strategies as the first line of response. And then they teach the other more physical strategies. A lot of them also really emphasize monitoring your own behavior, which is super important because crisis is hard. When someone's engaging in very aggressive behavior towards you or even towards themselves, it's very emotional for the person working with them. A lot of times you'll get activated yourself and your heart rate goes up, you're frustrated, you get very emotional. And that can actually increase their behavior even more. If I start yelling, other people in the environment might also start yelling. If you can maintain yourself and stay calm, you have a better chance of dealing with it successfully without anyone getting hurt or needing to go into a restraint situation. Understanding your personal space and proximity is really important. There's this idea of a bubble, and as long as they're out of your bubble and not hurting themselves, you may not engage and just allow this to happen. Utilizing team intervention strategies, we typically do not restrain with one person. You always want to restrain with more than one person. And then observe and detect early warning signs. So identify and escalate behaviors before it peaks. CPI is a crisis prevention institute. They're very similar. That focuses on preventing and managing crisis situations. CPI approaches approach emphasizes prevention and de-escalation techniques, providing a framework for staff to respond effectively to behavioral crisis. Yeah, and they create like a stage where someone would go through these stages with the behavior and the staff response. They emphasize empathetic responses. I love CPI. It's probably my favorite. At the time that I did it last, I hadn't gone through a lot of my master's programs training, so I've had a lot of training in counseling. But this was like almost like it was like an early introduction to counseling, like active listening, mirroring their statements, empathizing with why they're upset. And so you can't always do that depending on whether you're working with someone who's speaking or not, but it does really help if the person is speaking. So I do really like this one. Escalation cycle is how they get to their behavioral crisis. And so what you want to do is a lot of this is understanding the antecedents and the triggers and the precursors. So antecedents and triggers are the things in the environments that's going to cause them to go to behavioral crisis. And then precursors are those behaviors that they engage in before the crisis behaviors, the harmful behaviors. And so it helps understanding their escalation cycle for every person is individualized, but understanding their escalation cycle will like allow you to know when we're going to engage in proactive strategies and when we need to engage in reactive strategies. And it allows us to engage in this de-escalation. So early warning signs are your triggers, your antecedents, and your precursors. So pacing, and so primarily you're looking for those precursors. So pacing, clenched fist, increased vocal volume, refusal to comply with directions. Identifying and intervening when the crisis peaks is crucial for safety. So everyone's different. I mean, I had a student who clapping was a precursor to the aggression. Like it could be anything. It doesn't necessarily mean these are more common, of course. You know, a lot of us have similar anger behaviors. It will depend on that person. So in the early stages, you really want to stay calm and neutral. You don't want to escalate yourself. If you escalate, they will escalate with you. I promise. There's no situation I've been in where the tech or the person working with them or the caregiver if they start escalating, the person also will start escalating. Use short, clear directions. So real simple, direct directions to guide the students to better behavior. Offer choices with big reinforcement. If you have any big reinforcement available, then offer those. Provide space. A lot of times space is everything. So if you just leave them alone for a bit, they calm down. I have a 6-year-old who engages in, it's not really behavioral crisis. He's not aggressive. He just blows up a bit. He needs space in that moment. If I just tell him to go sit in his chair and look at his toys, he'll calm down in 20 minutes. He doesn't need anyone with him. My partner, my husband, and his father often want to talk to him through it, like just continually talk to him, and it gets worse. If you give them the space, a lot of kids can calm themselves down, or adults, anyone with space. If you're having a fight with someone, space can change everything. The hormones that create anger and aggression have a 20-minute life in our brain. So if for 20 minutes, nobody does anything that's going to escalate you or give you more of those chemicals, they'll come down. So if you can provide space for 20 minutes, do that. Take a 20-minute break. Keep an eye on them so they don't hurt themselves, hurt others, property destruction, but you can keep an eye on them with a distance and see if they can just calm themselves down. If you haven't done that yet in with any learner, give it a little bit of a try and just see if that is a solution. I would say it's like a solution in 80% of these situations. Adjust your body language, facial expressions, and tone of voice to convey supportive and non-threatening. So you don't want to be angry. You don't want to get louder. Even if they're getting loud, you stay soft. Stay calm face, relax face, not happy, just relax. Honestly, I don't know a lot about this, but try Botox face. Your face shouldn't make emotions. Just have it really, really relaxed when you're doing this. Don't furrow your brow. Don't put your mouth down. Just totally relax. It does help a lot. So when a behavioral crisis peaks, only trained staff should use physical interventions is absolutely necessary. So if there is physical interventions, this needs to be written in the behavior emergency plan. And it needs to be a team response. Team is always safer than individuals. Most of the time, if a child's going to need a lot of physical intervention, most of the time, what needs to happen is there needs to be 2 techs scheduled for therapy. This is hard because that's double pay, double all that. And a lot of times, insurance companies may not pay for that. Sometimes they do. But if you are in a situation where you feel like you're getting to a point where you need physical intervention, which is restraints, a lot, you need to ask for another person to be with you. It is unsafe to do physical restraints alone, and typically parents aren't great at it. I've seen companies try to use a parent as a second. They're never really great at it. So it would be better to have 2 techs do that, or you and your supervisor is fine as well. So if it's looking like that's the situation, then you need more help when you're giving these learners therapy. In a clinic, that's usually easy, right? There should be more than one person around. So there's always techs around. There's always people around who can help you. But this is typically a problem. Same in a school. There will be more staff to help you. It becomes a problem in home-based services when you're working alone. Make sure you know what you need to be effective. Maintain safety, continue to monitor the situation till everyone's safe. Always, even if you're in restraints, it's supportive, calm tone. You're telling them you understand why they're upset. I understand why you're feeling so angry right now. And honestly, they're communicating something they need. So get that in your head and you'll truly feel that way as well. Don't process the behavior. Don't analyze it in the moment. We are going to do that. That will be done with your supervisor. We'll go back to the table and look at everything and how we can address this when it's fully over. Honestly, it depends on what the situation is. Sometimes we have to have a meeting right away. It's so immediate. But a lot of times I like giving my tech some time to process what happened because they'll have better input if they just have a little bit of time to process. Your body and mind have to get over the crisis as well. And it's with anything. If you've ever had an altercation with a person, whether it's someone's upset about a line or whatever, airports, people get upset all the time there. In the moment, you're not making good decisions. Immediately after, you're not thinking about it right. And then 24 hours, like after you've slept on it and you get to engage in like a little bit of self-care, whether that's exercising, drawing, like doing something that you just enjoy doing, then you can typically process it better. And you know what happened, why it happened, like what you could do better next time, what they should have done maybe. All those things. So you don't want to ever process what happened in the moment. Monitor for re-escalations. Be vigilant if they're going to re-escalate when you're in the moment, because you might, this definitely happens so much. You like release restraints and then immediately you're still in crisis. So make sure you're watching everything. Legal and ethical considerations. You cannot do physical restraints if you are not trained and they're approved. There's a plan and it's documented when you do it. That's all has to happen. We're going to talk about documentation later because it's super important that you're very honest in the documentation. And then you're going to avoid assumptions and emotion-based language when you document, and always follow the plan. Okay, no matter what, it's always should be in the plan. It shouldn't be done unless it's in the plan. Before the crisis, understand the triggers and the precursors and early warning signs. Use de-escalation techniques like providing choices, offering space, maintaining a calm demeanor. During the crisis, only trained staff should use physical interventions as a last resort, and it should be in the behavior intervention plan, emergency plan. Respond to a team as a team for greater safety. Maintain safety, but begin supportive tone as soon as possible. Afterwards, we're going to document, we'll talk about that, and then reporting it. You need to immediately report it to your supervisor. I'll see you in the next video.